Good morning, everyone. I'm Al Turgeon. I'm the Chief Risk and Public Safety Officer for the university. Thank you for joining us this morning. As part of our efforts to deal with the COVID-19 pandemic, we are requiring an employee daily health screening requirement on us that's been imposed on the university by the governor. And there are a few things we'll walk you through here this morning with a very competent panel. So the first thing is that all UVM employees are required to submit a daily health screening check-in on the days that they are scheduled to work. Employees are not required to report their daily health screening results on the day that they are on vacation or on approved time off. Student employees will report their daily health screening results through the student reporting process and not through this check-in for employees. Perhaps another way to say it is if you're primarily an employee, then you would be using this procedure. If you're primarily a student, you've come to the university to be a student, then you'll be completing the student version, which is Co-Verify. It's an app that students will be able to download, and that's a different part of the university that's actually doing that work. So we'll be able to answer a few basic questions around the student version, but we won't be able to answer all your questions since it's not our direct responsibility to develop and employ that particular app. So we're recording this session and we'll be sharing those with you on the UVM Strong website. So if you need to follow up and review the information, you'll be able to do that. We are going live today and we'll be asking everyone to start reporting beginning tomorrow. Additionally, we'll be developing a paper-based form for those employees who do not have internet service, do not have a smartphone. They'll be able to print a paper copy of this and keep it near their landline phone and call in to their supervisor with the information that the daily health screening will be asking folks to complete. Next slide. So besides myself, we have Michelle Pavola, who is the director of the Center for Health and Wellbeing, Rodman Corey, who's a senior labor and employee relations specialist, and Tessa Lucy, the director of compliance services and the university's chief privacy officer on the panel. I'm actually going to turn it over now to Tessa, who will do the moderation through most of the rest of this presentation, and then at the end we'll open it up and take your questions and try to answer as many of those as we possibly can. Tessa?
Thanks, Al. So as Al said, the purpose of today's training is to walk you through the daily health screening form and to explain how the process is going to work. As Al said previously, this form is for employees, faculty, staff, temporary employees. This form is not for student employees. As Al said, there's a separate process for that, and they'll have their own app. Also, to emphasize what Al said in the intro, if you are both a student and an employee, you want to fill out the form that corresponds with your primary affiliation. So if you are at UVM as an employee and you're taking some classes, your primary affiliation is an employee. If you're at UVM as a student, but you're working while here, your primary affiliation is a student, so you would fill out the student form. So what you're going to want to do before you come to work, next slide, please. Before you come to work, you go to the website that's in the yellow box, which is healthcheck.uvm.edu/employee. Just as a side note, you may want to bookmark or save this page as a favorite so you can easily get to it each day. If you're not already signed into UVM services, you're going to get your login page to sign in. It's the same as you would for PeopleSoft. Once you're signed in, you're going to see instructions. You have to, what the instructions say is you must fill out this form every workday unless you exclusively work remotely or are taking approved time off. Complete this form before arriving to work. What that means is that if you work a schedule where you're on site some days and then you go remote for other days, you still need to fill out this form on the days that you're remote. Only if you're exclusively remote or on approved time off do you not need to fill out the daily form. And this is something that has raised a lot of questions. So I want to emphasize that you are required to log in and fill out the form, even if you're not coming to a UVM facility, unless you're exclusively working remotely or unless you're on paid time off, so vacation, leave time, etc. If you work on campus Mondays and Wednesdays, but are remote Tuesday, Thursday, and Friday, you still need to fill it out on Tuesday, Thursday, and Friday. Next slide, please. We put the health check form behind UVM single sign-on in part to further safeguard your personal information. So along those same lines, you'll see a privacy information button. If you click on this, you get a brief statement describing UVM's responsibility to protect the information, how UVM will use the data, and who will have access to it. If I switch to my privacy officer hat for a minute, really what I want you to know is that this is something that the committee has taken very seriously when we developed this process. Next slide, please. When you log into the form, this is what you're going to see. I'm going to jump to question 2 first, and then I'll come back to question 1. So question 2 asks, what is the net ID of your supervisor or designee? This will be pre-populated with the net ID of your supervisor that's listed in PeopleSoft. Some areas have designated somebody else, such as a lab safety officer or an HR rep that's responsible for the daily health screening process. So you do need to double check the net ID of who is in this box. Whoever is listed here is the person who's going to receive your notifications. Supervisors, what this means is that you need to inform your direct reports if they need to send it to somebody else. It also means that if supervisors or designees are going to be out on vacation or not in the office, they need to inform their employees who they should send their forms to in your absence. We are looking into adding some functionality to simplify this, but for the time being, supervisors need to assign a backup and communicate that when they're going to be away and otherwise not able to check the responses. Now for employees, if you haven't been instructed to submit this to someone else, send it to the default net ID. If you have been instructed to submit it to someone else, you need to click on the box and replace the net ID with whoever your designee is. If you're not sure who that is, you should ask your supervisor and they can let you know. If you're not sure what the net ID is, you can always confirm that in the online directory. So you would go to the online directory, search for the person you need to submit your form to, and you'll see a column right there that has the net ID listed. If you do need to change the net ID, you should only have to do that once, but you should still check it daily to make sure that it's the right person. All right, so now I'm going to go back to question 1. The first question on the form is, are you planning on coming to a UVM facility today? And to emphasize, unless you're solely working remotely or on approved time off, you still need to fill this out. If you're working remotely for the day, you merely verify the net ID of your supervisor or designee, answer no to question 1, and hit submit, and you're done. Next slide, please. When you do that, you'll receive a response that says, thank you for submitting your health check-in form. If circumstances change and you plan to come to a UVM facility today, please log in and update your response. What that means is that after you've submitted it, if something changes and you are in fact coming in to a UVM facility, all you have to do is log back in and change your response. You have the ability to fill this out more than once depending on how your day plays out. Next slide, please. And if you are scheduled to come into a UVM facility and answer yes to question 1, that's when you're going to see the rest of the questions. Next slide, please. You click on yes for question 1, and the other questions just magically appear. This slide is probably hard to see on the screen, so I'm going to go through each question individually so you're clear on what each one means. You'll also see that the net ID question got bumped down to number 6, but it is the same question. Excuse me. The questions are primarily broken down into 3 categories. You've got symptom questions, contact, and travel. Questions 2 and 3, which are the symptom questions, are the ones that are going to ask you about symptoms over the past 72 hours. So question 2 reads, in the past 72 hours, have you developed any of the following symptoms that cannot be attributed to a pre-existing condition? Those are cough, shortness of breath or difficulty breathing, fever or chills, new loss of taste or smell, and sore throat. We've also included the definition of fever on the form in case there are any questions there. The trigger for this question is whether it can be attributed to a pre-existing condition. As an example, someone with asthma who frequently experiences shortness of breath, if their only symptom was shortness of breath, but it's a pre-existing condition, they would answer no to this question. On the other hand, if you suddenly develop shortness of breath and you didn't have a pre-existing condition, if you had no idea where it was coming from, you'd respond yes to this question. The second symptom question is question 3, and that question reads, in the past 72 hours, have you developed any of the following symptoms that cannot be attributed to another condition? And those are fatigue, muscle or body aches, headache, congestion or runny nose, nausea or vomiting, or diarrhea. Again, we only want to know if you have these conditions and they're unexplainable. So for example, I rarely get headaches, and if I do get one, it's almost always because I didn't drink enough water the day before. So if I woke up in the morning and I had a raging headache, but I knew I was dehydrated, I would answer no. If I woke up with a raging headache and couldn't explain it, I would answer yes here. So those 2 are the symptom questions. I'm going to move on to the contact question, which is question 4. And that question asks, today or in the past 14 days, have you been in close contact with a person who has or is suspected by a medical professional to have COVID-19? Close contact is defined as being less than 6 feet from an infected person for at least 15 minutes. For this response, the emphasis here is on medical professional. If you had dinner with your brother-in-law and he was sneezing but otherwise didn't test positive or wasn't diagnosed with COVID, you would answer no. On the other hand, your brother-in-law calls and says he just got test results and they were positive, you would answer yes. And then question 5 is the travel question, and I'm going to hold on that for a minute. I'll get into more detail further in the presentation. But for now, let's assume that you answered no to all questions 2 through 5. So you had no symptoms, no contact, and no travel. Next slide, please. This is the response that you'll see after you hit submit. And it reads, based on your responses, you are cleared for in-person work today, and it provides you with today's date. And then you're done for the day, you can come to work. Next slide, please. If you did have, if your day changed and you were called in or you had to come to work, again, you could log back in and fill it out. So what happens if one of those responses was yes? In that case, the messaging is going to be different and your responsibilities will be different. So if you answered yes to 1 or more questions, 2, 3, or 4, this is what you would see. Next slide, please. Your response suggests that you may be at risk for having COVID-19. Please contact your healthcare provider to discuss your symptoms and call your supervisor to inform them that you will not be able to work from a UVM facility today. You may not return to a UVM facility until you have been cleared by a healthcare provider. If your healthcare provider recommends you for a COVID-19 test, please inform them that you are eligible for on-campus COVID testing. Please contact the COVID-19 Information and Service Center for further information about on-campus COVID testing. And then it provides you with the contact info, which is email uvm.strong@uvm.edu, and the phone number is 656-1010. You might be wondering what cleared means, and if you answer yes to 1 or more questions 2 through 4, and you get this, you may be at risk message. You may not return to a UVM facility until COVID-19 is ruled out. The way to rule it out is either with a negative test result or by a healthcare provider determining that the symptoms are not due to COVID-19. You don't need a written documentation or a doctor's note, but you do need to obtain that determination from a healthcare provider and communicate that to your supervisor. If you're interested and want to read the state of Vermont guidelines, I've given you the link there in the yellow box. In any event, If you answered yes to question 2, 3, and or 4, you will need to contact your healthcare provider and they will advise you on an appropriate course of action. Next slide, please. All right, now I'm going to go back to the travel question, which is question 5. And this one reads, have you traveled outside Vermont in the past 14 days for non-essential reasons? This part of the form has a bit more functionality built in, and it was designed to make it as easy as possible for you. We've included a definition of essential travel, which is travel for personal safety, medical care, care of others, parental shared custody, for food, beverage, or medicine, or to perform work for businesses that are currently allowed to operate. So let's say you did travel for non-essential reasons and you answer yes. And at that point, these other questions will pop up. The first is, in what country did you travel? And because travel outside the country, regardless of where you go, results in the same restrictions, your options here are only 2. So from that drop down, you have either the United States or other. I'll start with international travel. So if you travel outside the country, you would choose other, and that's really all we need to know. In that response, the next 2 questions will default to all locations, and you can't change that. Next slide, please. Now, assuming you answered no to all questions 2 through 4, and if you traveled outside the country, you hit submit, and you get this response. Your responses suggest that you may have been exposed to COVID-19 through recent travels and may need to self-quarantine. Please call your supervisor to inform them and contact the Vermont Department of Health at 802-863-7240 for next steps. Next slide, please. Domestic travel is handled a little differently. The state of Vermont determined that any county with less than 400 active cases of COVID-19 per 1 million residents is now eligible for quarantine-free leisure travel. And that comes right from the state of Vermont guidance. So if you did travel within the United States but outside of Vermont for non-essential purposes, whether you can come to work without quarantining or come to a UVM facility is going to depend on where you traveled. I'm going to show you both scenarios here. I'll start with travel to a quote-unquote safe county. So for this example, let's assume you went to York County, Maine. You would answer yes to question 5, select United States from the drop-down, Maine from the next drop-down, and then York from the next drop-down. Verify your supervisor, hit submit. Next slide, please. Again, assuming you answered no to all the symptom and contact questions, you're going to see the same cleared for in-person work response, which is based on your responses, you are cleared to work in person and provide the date. Next slide, please. Now, if you travel to a quote-unquote unsafe county or a county that's outside of the Vermont travel area, you're going to get a different response. So for this example, I'm using Broward County in Florida. So since Broward County is outside of the Vermont travel area, when you submit the form, you would get this message. Next slide, please. Your responses suggest that you may have been exposed to COVID-19 through recent travels and may need to self-quarantine. Please call your supervisor to inform them and contact the Vermont Department of Health for next steps. So even though this example is for a county outside of Vermont, of the Vermont travel area, you're going to get the same response if you traveled within the Vermont travel area, but to a county that has more than 400 active cases per million. So if your response to the travel question indicates that you need to quarantine, you may not return to work in a UVM facility until you have successfully satisfied the state of Vermont quarantine requirements. And those are currently either a 14-day quarantine without symptoms or a 7-day quarantine without symptoms followed by a negative test result. If you travel to a county outside of the Vermont travel area, you need to contact the Vermont Department of Health to see if you need to quarantine. Next slide, please. So I do recognize that that was a lot of information, but let me try and just summarize for you. So in a nutshell, if question 1 is no, you're done with the form unless your circumstances change for the day. If it's yes, you need to fill out the rest of the form. If you answer no to the symptom questions, no to the contact question, and no to the travel question, you can come to work. If you answer no to the symptom question, no to the contact question, and you travel to a safe county, or if your travel is considered essential, you can come to work. if you answered yes to one or more of the symptom or contact questions, or if you traveled out of the country to an unsafe county or to a county outside Vermont's travel area, you cannot come to work until you've been cleared. So the way this form was designed, you don't have to remember all of this. Really, the most important thing you need to take away here is that the responses you receive on your screen after you hit submit is based on the answers you provide. The form is designed to give you instructions on what you need to do if you haven't been cleared to work in a UVM facility. So what that means, what does that mean for supervisors? And for this next section, I'm going to hand it back over to our Chief Risk Officer, Al Turgeon. Al, next slide, please.
Tessa, thank you very much. That was well done. So the first thing supervisors are going to need to do is first log in using your NetID and password, as you would normally do anytime you're going to a UVM source of data. And once you're in the form, there is a supervisor view in the upper right-hand corner. You won't see the supervisor click here arrow. That's only for the purpose of pointing that out to you. So just go to the supervisor view and click on that, and this is the screen that you'll see at the beginning. Now we've broken down all of the steps that the supervisor needs to take and the information that they need to understand in multiple slides here. But the page starts with a list of your responsibilities. That's all of these items here, 1 through 5. The first thing that you need to make sure of is ensure that all non-student employees you supervise have completed the screening form unless they are exclusively working remotely or they're taking approved time off. For student employees, ask the student to show you verification that they've completed the student health screening on that day. So they're going to be using Co-Verify. The Co-Verify app will either produce a red circle with a diagonal line through it that basically says they're not cleared to come to work, or they'll have a check mark and they'll be able to show you that when they do come in for work on their smartphone. So that'll be the way that you'll be able to recognize whether they're cleared to go to work. If an employee has responded yes to one or more of the health screening questions, that employee may not work from a UVM facility that day and may not return to work unless they are cleared by their healthcare provider. Now, what does cleared mean? If you click on that box, what you'll see is what's in this little window here. Any employee who responds to questions 2, 3, and 4, which are the symptoms and close contact questions, they indicate that they may be at risk for having COVID-19, so they should not be returning to work until COVID-19 is ruled out. How it's going to be ruled out is one of two ways. Either they're going to take a COVID-19 test and that will be negative, or a healthcare provider will follow up with them, ask them additional questions, and determine that they do not have COVID-19. We don't need written documentation from the healthcare provider. We just need that the healthcare provider to verbally say that that person is cleared. If you want to understand more about these guidelines, you can also check the Vermont Department of Health, and there's multiple places throughout the presentation that we will be sharing with you, and the app, or I'm sorry, the web-based form that you can go to their website. An employee who responds to question 5 and indicates that they need to quarantine may not return to work until they have successfully satisfied the state of Vermont's quarantine requirements. Currently, it's 14 days without symptoms or 7 days without symptoms, followed by a negative test result. If none of the employees have checked off any of the 4 COVID-19 specific areas of inquiry, no further action is required until the next day. And we'll just be reminding you here to take a look at it on the next following day. Next slide. So the rest of the dashboard looks like this. So I just went through the 5 questions, and you're going to have 3 boxes that will summarize the responses that you're getting from your employees. The first is the title check-in in blue, which indicates the number of employees who have filled out the form for which you are responsible. The next box that reads permitted on site in green indicates the total number who are permitted to come to work at a UVM facility. And the last box labeled potentially exposed in red letters is the total number who are not cleared to come to work in a UVM facility without first taking further action. The summary data is then further detailed below in those boxes. Next slide, please. So you will see that the employee name in the first column is followed by 3 columns labeled working on site, symptoms or exposure, and travel quarantine. If you hover your cursor over the column header, you will see some additional text that we've enlarged here on the right side of the screen. I'm going to focus first on the first column, which is the working on site. This means that an employee can come to the facility today. If you see a yellow row that indicates no check-in today, it means that the employee didn't fill out the form out for that day. And if the employee is exclusively working remote, or if the employee is on approved leave, you wouldn't need to do anything. Otherwise, you will need to follow up with the employee and have a conversation to determine why they didn't fill it out and to stress the importance of compliance with this state mandate. Remember, they are not allowed in a UVM facility if they have not filled out the form for that day. Moving on to the other rows and symbols, if you see a dash under the working on site column, it means that it was filled out and they indicated but were not scheduled to work in a UVM facility today. If you see a check mark, it means they filled it out and are cleared to come in. For the unhighlighted rows, unless something is not adding up, for example, having an employee indicate that they are not coming in but have in fact come in, you do not have to do anything else with these. They are either not coming in or otherwise cleared. If you have rows highlighted in red, that means the employee has not been cleared. You will also see a red circle with a line through it. That means that the employee cannot come in and will have to take some sort of action in order to be able to come to work again. What those actions are will be indicated by the red exclamation point. If it is under the symptom or exposure column, then they need either a negative test or clearance from the healthcare provider. If the red exclamation point is under the travel quarantine column, that means they either need to determine that their travel was to a safe county by contacting the Vermont Department of Health, or they need to complete the state of Vermont's quarantine requirements before coming back to UVM facility. Employees who are in a red column are allowed to work remotely if that work is approved by the supervisor. Not being cleared to work in a UVM facility does not mean they can't work, period. It means they can't work on site. So if a job or position allows for remote work and the employee is not otherwise ill, there would be nothing preventing supervisors from making those decisions. For student employees, as mentioned earlier, they will have their own app. The Co-Verified app has functionality where students will get a green screen or a red screen depending on their responses. Green means that they're okay to work and red means that they are not. Student employees are required to show supervisors their screen indicating that they have been cleared to work. If they show up and are not able to show you their cleared screen, they are not allowed to work until they're able to produce it. And if you have questions, you can also contact the COVID-19 Information and Center Service Center at uvmstrong.edu, and their contact information and number is located here in the bottom right-hand corner in the yellow box. So this concludes our presentation. And before if you have questions, you can start posting your questions now, and we'll begin that shortly. But I'm going to open it up to any of my colleagues if there's anything they want to clarify before we go to questions. Colleagues?
Great job, Al. As Al said, we're going to open it up for questions now. So I'm just going to wait to see a couple questions that are posted. So the first question here is, and I'll take this one, when is this form available? And the form will be available today. We're opening it up for usage today, Wednesday. Okay, next question. And this is actually multiple questions. The first one is for Rodman. How do I know if and for whom I might be a supervisor?
Okay, good start. I feel like I get the difficult questions. That's a PeopleSoft question, and so that should be listed in PeopleSoft. Your HR rep or business manager ought to be able to help you figure out who are listed under you in PeopleSoft.
Great, thanks, Rodman. I'll take this second one, which is, why does essential travel automatically lead to clearance? Essential versus non-essential travel is not based on COVID-19 exposure risk. And the reason for that primarily is that is the guidance or the requirement that has come from the state of Vermont. The expectation is that essential travel is something that is fairly quick. You might travel somewhere for medication, for grocery shopping. You also might live in New York State and you work at UVM, so you would be traveling back and forth for work. So the thought behind that is, again, it's from the state of Vermont, but it's also not like vacation travel where you're going to restaurants and hanging out with large groups of people. The next question, let's see, Rodman, for you. I assume that a no to question 1 indicates remote work. What if I have mild symptoms? Actually, this would be for Michelle, sorry. What if I have mild symptoms that might be allergy and decide to work remotely to see how this develops?
I think if you have mild allergy symptoms, and that's a great choice to see how things develop. And if you can work remotely, that is also a great option. So I think if you answered no to question 1, that you're working remotely, then you don't have to indicate, you're not going to be asked to fill out the symptom questionnaire. So I think I'm trying to interpret this question a little bit.
All right, so if I could jump in, folks, I think the question is, if I have symptoms that I think may be something else, but they could be COVID, do I need to tell anybody that they could be COVID? I think you have to use your best judgment. It's not always going to be black and white. And so if you get up in the morning and it's September, and normally in September you have allergies, you don't need to indicate that to anybody at the university. If you start to get some of the other symptoms that you're not used to, you're running a fever, etc., then at that point you're going to say, this isn't my seasonal allergies, this is something else. You're going to complete the form differently.
Thank you, Rodman.
Sure.
Yep, thanks, Rodman. And also, you would want to have those conversations with your supervisor. So, if you are, if it's not being triggered because you answered no to a question, but you want to be able to just see how it plays out, again, those are the types of conversations you'd have with your supervisor to make a plan for your day. Okay, Michelle. If it's determined that an employee needs a COVID-19 test, can we get tested at UVM even if we're not students?
Yes, the UVM administration has made arrangements for employees to be able to get tested if they're having symptoms at one of our testing sites where we will be testing symptomatic students. So what you would do is contact the COVID-19 Information and Service Center, and they will help facilitate getting you an appointment at one of our testing sites.
Thank you. Next question, I will take this one. If a supervisor wants to designate someone to receive these forms, do they need to do anything official, or do the employees just use that person's net ID? Really what the supervisor needs to do is to communicate that with obviously with the person who's going to be receiving them, but also with their staff that report directly to them. So they're going to want to have, you know, some sort of official communication so they know exactly where they're going to be.
So the answer is no, they don't need to do anything official. You do not need to do anything else. Nobody centrally needs to know.
Thank you, Rodman. Next question for faculty teaching remotely. Rodman, for you, I need to go into the office to grab some things. Do I just fill out the form for the day? I'm visiting campus.
Yes, that's exactly what you would do. If you are teaching remotely and you don't have a regular schedule of coming into the office, you would just fill out the form on the day that you come in.
Right, right. And just to provide a little bit more detail around that is, you know, if you are working exclusively remote and you just have to come in, you know, as Rodman said, you would fill it out on that day. But if for any reason you are working, you have regular scheduled days, or you regularly come in to perform a job-related task, you would want to fill it out every day, even when you are working remotely. Let's see, Rodman, if I cannot work due to answering yes to a travel question, is it considered a sick day or vacation day, or just a work from home day?
Oh, difficult question. There is an update coming out in the next few days to the travel policy, which may speak to this specifically. It definitely could be a vacation day. It also definitely could be a work from home day. If you are able to work from home, if you have work to do and your supervisor clears you to work from home, then you should probably do that. The question behind the form is, can I come into work? And if the answer is no, you cannot come into work because of where you have traveled and the reasons for which you've traveled, then you are still cleared to work from home if your supervisor approves it.
Thanks, Rodman. And I am going to give the next one to you as well. Will I be compensated for my time to fill out this form?
No, you will not be compensated. It's a state requirement, actually from the governor's office, that these forms be completed before you arrive at the workplace. And General Counsel has determined that this is de minimis. In other words, it's too small to be concerned about compensation. It should take somebody less than 2 minutes in most cases, in many cases less than 1 minute once they get the hang of it, to complete this form. So no, you would not clock in, you would not signify this in any way on your timesheet. It is not compensated.
Thank you. And I'll take this next one, which is how does it work if a staff member is also a student or taking classes? And really what you want to do is you fill out the form that's associated with your primary affiliation. So if you are an employee who is taking classes, your primary affiliation is an employee, you fill out the employee form. If you are a student who happens to also be working at UVM, but your primary affiliation is student, you would fill out the student form. The next question, Michelle, can staff use UVM testing for the 7-day test if they travel to a non-safe area?
Yes, yes, staff can use the UVM testing, and so this would be a separate, so this is a separate testing site than where we would test people with symptoms. This is going to be at the Davis Center, and there's going to be a way for employees to get a weekly test if they want to. So you could schedule your weekly test on the day, you know, your day 7, so that you can get off your quarantine early.
Great, thank you. Rodman, is this form required for contract labor staff?
Any employee who has a net ID should be using this form. If they do not have a net ID, they should be reporting to someone that they are cleared to work based on the questions that are being asked on the form. So that would be where a paper copy of the form would come in handy. The point is to to ask, virtually everybody coming onto campus these questions to try to keep folks as safe as possible.
Great, thank you. Michelle, on question 4, if you work in a hospital, do you need to check yes or no answer on being in close contact, as we don't know if one or many may have COVID?
Yes, this is a good question. So the hospital has its own protocols when they have a patient that becomes, they test positive and they've been in the inpatient setting. And if they feel like an employee or staff member has been a close contact of them, they will inform you. So I would say check no, unless you're informed that you were in close contact with somebody who became positive.
Great, thank you. And we've had this question before in other presentations. Michelle, I'm going to give this to you as well. What if you travel to a green county on August 1st, but then sometime within the 14 days, it turns yellow? I'm assuming when you enter time on August 10th, it will say that you are still at risk.
Yes, and you will still answer yes and have a conversation with your supervisor just to let them know that you were not in that county when it was yellow or red. And then once the 14 days from the time you were last there expires, you won't have to answer yes to that question any longer.
Great, thank you. Rodman, how are you communicating this screening to employees whom English isn't their first language?
So Custodial Services is working on a handful of translations that they will be passing out to employees who do not read English, so that they can complete the screening.
Thanks. And I'm also going to give you this next one, Rodman. So if you are homesick for 1 or multiple days, should you also fill out the form, or is this considered an excused absence?
Again, here there's no hard and fast rule. I think if you're out for a day or two, whether it's related to COVID or something else, you should probably fill out the form and indicate that you're not coming into the office. If you recognize that you have COVID, if you're diagnosed with COVID and it becomes a longer term thing, then the conversation with your supervisor could be, I'm not going to fill this out for the next 2 weeks. So again, it's not going to hurt anybody to fill it out, but we don't expect somebody who's sick in bed to get up in the morning and fill it out just because. So folks are just going to have to be reasonable with that.
Great, thanks, Rodman. And I will take this next one. What about employees who work remotely 95 or more % of the time, but occasionally need to go into the office to pick up mail, supplies, or use the photocopier? Should we be filling this out daily as well? And it's really going to depend on the function of your job. So if you are the person who is coming in once a week to pick up mail, and it's routine, it's part of your job, then yes, you would need to fill it out Monday through Friday. If, on the other hand, you are exclusively remote and, I forget a file back at my office and I just have to go in for that incidental reason, then you would only need to fill it out before coming into the office. You wouldn't have to fill it out every day. Okay, Michelle, if an employee works a good distance from campus, like in an extension office, will UVM provide COVID testing for employees across the state or just on campus?
The COVID testing for employees is available on campus only.
Great. Let's see, the next one, Rodman, I have employees on site after hours with no supervision. How is the supervisor required to check the dashboard when not at work?
I would say that generally a supervisor would not be checking the dashboard when they're not at work. It's not to say that they couldn't, but generally that would not be an expectation. For the employees who are scheduled to be on campus during, say, a second shift or a third shift, they should be given a net ID for somebody who's going to be on campus with them so that somebody who is there can follow up. Right, the net ID is fluid. It can change daily if it needs to. Individuals just need to be instructed which net ID to use, It could be an HR rep, it could be a safety officer, it could be a logistics coordinator, it could be a different supervisor who's going to be on campus during that shift, but generally it should be somebody who's going to be on site.
Great, thanks. And that really answers the next part of this question, which was, can someone who has functional supervision get the form if no supervisor is on site? The answer to that is yes, as Rodman had just explained.
Right, and if I could just take a moment, Tessa, I think it's going to be, for some departments especially, you need to think carefully about how you want to handle this and who is going to receive these forms. In some cases, you may decide the best person is the logistics coordinator, or the best person is the business manager or the HR rep. It might not always be the supervisor. So think carefully about that.
Great, thank you. And if you work the day, Rodman, another one for you. If you work the day and get called back after hours, do you need to fill it out again?
What time do you get called back? No, I'm just, I mean, I think that's a gray issue. Generally, if you're coming to campus, you should fill it out. To me, if you get home at 3:30 and you're asked to come back at 4:30, do you need to fill it out? That seems like asking a bit much. If you're asked to come back at 10 p.m. or 2 a.m., then probably there would be an expectation that you would quickly fill one out before you come back.
Great, thank you. Let's see. For those of us that work in the field or with the public, how do we respond? We aren't going to a UVM facility, but it isn't remote work either. Rodman?
So if you're going to work, for most people, that's going to be at a UVM facility, right? It may be at the horse farm, but it's at a UVM facility. For some folks don't do that. They report to work somewhere else, somebody's home, a field somewhere, the top of a mountain. I think that if you are going to work, you need to fill out the form.
Right. Yeah, and we do have employees who report to schools and all different types of facilities. So as Rodman said, if you are going to work, if you're going somewhere to work, you should fill one out. Let's see, Michelle, if an employee is determined to not be eligible to work on site because of suspected symptoms, would they still be able to immediately come to the Davis Center and get tested, or would they need to go 7 days before getting tested?
So if an employee develops symptoms, they have the option of contacting the COVID Service Center and arranging to get a test on campus at one of our symptomatic testing sites. We're really not the Davis Center. We really want to keep people with symptoms out of the Davis Center testing site. So we have 2 separate sites for testing people with symptoms where we are having an elevated level of personal protective equipment on. So that's an option if you have symptoms. A second option would be to contact your healthcare provider and get guidance.
Great, thank you. Rodman, for you, we have staff that are assigned every day to regional hospitals. Are these employees required to log in and complete the first question?
Absolutely. Yes.
Yes. Let's see. Okay, this next question is more functionality. It's when I click on the supervisor tab, I am missing an individual who should be reporting to me. So what you would want to do is, if that person should be reporting to you, it's going to default to the supervisor listed in PeopleSoft. If that should be you instead of the supervisor in PeopleSoft, you would want to instruct that individual to replace the default net ID with your net ID, so you would get those responses. Rodman, will this form be translated for employees who do not speak English?
So yes, as I said, Custodial Services is working on translation of this form into 5, maybe 6 different languages for employees who do not speak, or more specifically, do not read English.
Great, thank you.
So I guess let me say, if you have employees who fall into that category who are not in custodial services, you might want to reach out to Caleb in custodial services, who is handling that translation work, and he could help you with that.
Great, thank you. The next question, Rodman, if you travel out of state and plan to quarantine upon returning to Vermont, do you still need to fill out the form?
If you travel out of state and you know that you're going to an area that's going to require quarantine, if you're taking a 1-week vacation, you should be asking for 3 weeks off. So if you're on vacation, you do not need to fill out the form. If you travel out of state and the county changes on you, the color of the map changes on you, all of a sudden you went to a place that that did not require quarantine, and now all of a sudden you've come back and it does, then that depends what we do with you. You probably in that case would not need to fill it out either. If you need to quarantine, you would probably choose to use emergency paid sick leave, EPSL, or vacation time, and not be expected to fill out the form.
Great, thank you. I'm going to open this to the panel. Who is monitoring subcontractors coming on campus?
I'll take this question. So our procurement office is maintaining a listing of all outside vendors and folks like the UPS, FedEx, etc. And they're having to fill out a statement that they're following all of the state of Vermont guidance around COVID-19.
Thanks, Al. And I'll take this next one, which is I work in a UVM Medical Center building. Do we have to fill out anything for UVM Medical Center or just UVM? And that's really going to depend on what UVM Medical Center is requiring. So if you are a UVM employee and you're working in a UVM facility, if you're going to be coming into a UVM facility, then you would have to fill out the form. If UVM Medical Center also requires you to fill out a form, you would likely have to do two separate forms. The next one, and I'll take this one as well. Where can we find written guidance that covers what you are presenting? We're recording this session, and we will have it posted on a website, which will be provided to folks after the presentation. Once it gets posted, we will provide a link to everyone. And it would be great to have quick guides that provide definitions of the various categories. And I think that's a great suggestion, and we can work on pulling some information together to have on that same website to have a easy reference for supervisors and for staff. Next question, Al, are we assuming that this process will be completed on an employee's personal device, iPhone, computer, etc.? And what if the employee does not have this option?
Thanks, Tessa. We have not made that assumption. We're believing there will be some employees that will not have either a computer or a smartphone to process this. So for those individuals, we will have a PDF version of the form, which they can print and keep at home and use a landline phone to call that information into their supervisor.
Great, thank you. And I'll take this next one is how does the screening tool account for asymptomatic cases, and will UVM be using any Bluetooth tracking? We are not using Bluetooth tracking. A lot of those types of systems have a lot of privacy problems. They also are very easy. So really what we're finding is that it isn't as effective as people originally thought that it was going to be. So we opted not to use Bluetooth tracking, at least at this time. Did anyone want to add any clarifying?
Yeah, I will just add about the asymptomatic cases that by asking the questions we ask about travel and exposure to COVID, trying to get to people who might be at increased risk for having it and not knowing. So that might be one of the ways that we are accounting for asymptomatic spread.
Great, thanks.
And I'd also like to comment.
Go ahead, Al.
And so we want you to understand why this is being done and how we're going to use any of the information here. So really, at the end of the day, it's a state mandate. It's information that you're providing so that you're really in a position to determine whether you come or don't come to work. You get medical advice, and that helps you make those decisions. The supervisor's role is really to make sure that all employees have done the daily health screen that are supposed to. For the health and safety officer for the university, who is designated by the president, that person is Francis Churchill, and that is also a requirement of the state. All we're going to be looking at subsequently on a daily basis is the numbers, how many total number of employees have actually done the health screening. We're not going to be looking at specific health information. That's not necessary. And the goal for the university, as we look at what the CDC, WHO, and other health organizations have said, our goal is to at least be at a 60% participation rate on a daily basis. That's the minimum expectation from these regulatory agencies. For us, we want that participation rate to be even higher. So that's really how we're planning to use information and what each of our roles are going to be going forward.
Great, thank you, Al. Michelle, if a person does not have a healthcare provider, where should they call?
If a person doesn't have a healthcare provider and they have some mild symptoms and want to get tested, they can call the COVID Service Center so that they can facilitate them getting an appointment at one of our symptomatic testing trailers. And if their symptoms are concerning or significant, they can go to the urgent cares in the area or the emergency room.
Great, thank you. The next one would be Michelle. My husband travels out of state regularly for work, and his travel is not to a safe county. Am I expected to quarantine?
No, you were not expected to quarantine unless you travel with him.
Great, thank you. I will take this next one. Now I'm confused about designating another person. Can I tell that person, and I can tell that person, and I tell the employees to use the designee's net ID, but would the designee then automatically have the supervisor view? And the answer is yes. So if you are listed in that supervisor or designee view, I'm sorry, if you're listed in the supervisor or designee net ID box, you will have the supervisor view. Can we, Rodman, can we deny a staff's request for vacation if they go to a risky area?
I want to say very clearly that if you have this come up, you should have, as a supervisor, you should have a conversation with your labor and employee relations professional. I think the short answer would be we are looking for employees to be honest about, you know, their plans. And if they're going to travel to a risky area where they would need to quarantine, they should be asking for 3 weeks. The denial would be based on not a question of what they did on their vacation, but of how much time they need. So, but let's have a conversation about that.
Great, thanks. And Rodman, I'll this next one as well. Are we being forced to use our personal devices, and what happens if we do not want to use our personal devices?
If you don't want to use your personal device, then I guess you would fall into the category of a person who gets a paper form and needs to make a phone call every morning to their supervisor to report their condition, their circumstances.
Great, thank you. Al, go ahead.
Yeah, I just want to reemphasize that we have taken into account the privacy requirements that that we need to take into consideration, and we're not monitoring, tracking your physical location whenever you're submitting these things. And we would want you to use a smartphone and a computer because the only way that we can roll up the data efficiently is to have you use an electronic device. So I'm encouraging you to use it. We are taking into account your privacy concerns.
Thank you, Al. And Michelle, if somebody does not have affordable health insurance, they might be hesitant to visit a healthcare professional. If they feel like their symptoms are mild, could a 14-day or 7-day quarantine with a test without symptoms work to allow the staff to go back to work?
That might work, and I understand this situation. That might work, the 14-day isolation period. But another available option is for them to come and get tested at one of our symptomatic testing sites, because when somebody has symptoms, the test we're using is very accurate for picking up COVID. So if they're tested and it's negative, then it's some other condition that is causing their symptoms.
Great,
So
thank you. And with that, we're actually out of time now. So I want to, on behalf of the panel, thank you all for joining. And as I had said earlier, we will make a version of this presentation available online, and a notification will go out to all faculty and staff with the link to the presentation. So thank you so much.